Hi, so this is video 4 now of my story, and I thought since I'm stuck under a sleeping toddler, this would be a good time to record it. Uh, so I was thinking back about video 3, and I feel like I explained pretty well that I felt like I was doing really good in new motherhood, and that comparatively to now, it was easier. But I don't think I did a great job of explaining that I still struggled with some anxiety that could probably be considered postpartum anxiety. Just around things like needing to be perfect and being the perfect parent, things that are a direct result from my childhood that I don't struggle with as much now, just because I think I'm more aware. And I think as you add kids, like, you just have to surrender more, right? So, just wanted to put that out there. But yeah, I think I left off saying that we are interested in getting pregnant again, and I used some herbal remedies to help me start menstruating again, and we did find out we were pregnant. About, I think it was within like the first 2 weeks after we moved into our new house, which decided we were going to renovate, of course. And at around 6 weeks, I felt like, that feeling again in the beginning where I just didn't feel real good. Luckily, that my second pregnancy, I didn't actually vomit, but I was pretty nauseous for about 3 weeks. So at 6 weeks, I started feeling pretty off, and then at 7 weeks, I ended up with a kidney stone. Had a lot of pain from that, and got a UTI as well from that, which is really common to get a UTI from kidney stones. And I tried to treat it herbally and just couldn't kick it. I think looking back, I just didn't know as much as I do now about herbs, and just my body was just struggling, I was under stress with the pregnancy and all that. I was still nursing Grace, and I believe at this point we were still nursing once or twice a night. So got through that, and at about 10 weeks, I started having a lot of pain in my left hip. And at this point, we hadn't decided on a home birth midwife yet. We hadn't hired one, but I had kind of decided on one, Wendy. And I remember calling her and saying, I know we haven't like officially booked you yet or whatever, but I'm having a lot of pain in my hip to the point that I like feel like I need to walk on crutches, because if I put pressure on it, I just like can't handle the amount of pain. So we decided that we'd start with chiropractic, and it was a Friday that I started having. I remember going to work and like limping around work on Friday. So I ended up going to the chiropractor Saturday. And then I believe I got a massage Saturday as well. And we were thinking sciatica. And then Sunday and Monday also got adjusted by a different chiropractor. And I believe it was Monday that I ended up contacting Wendy after that last adjustment because it was so painful that I had to stop in the middle of adjustment and go to the bathroom to throw up. And I contacted her and I just said, something's not right. And she said, I think you need to go in to make sure that you don't have any blood clots. So I did. I went straight to Genesis from there, and they diagnosed me with a deep vein thrombosis, so DVT, in my hip area, my left hip leg area, and told me I should not have a home birth. They shamed me pretty heavily for even considering it. And I said, obviously things are a little different now, so I'll have to make another decision or whatever. But, and gave me a shot of Lovenox in my abdomen and said, okay, you're going to have to do this for the rest of your pregnancy. And told me to go home and follow up with an OB. They said, you don't use your crutches, try to walk like normal out of here, and so that I could go back to work and everything. And they said, we're not worried about the blood clot traveling. So I tried to walk on my leg, and it was still very painful, so I ended up having to use the crutches. But the next day, I saw an OB down in Royal Oak, and it was just one that Wendy referred me to a practice, and I couldn't get in with the OB that she referred me to, so I just went with another one in that practice. And I remember, it took all of my effort and energy to even get ready to go to that appointment. And then when I got there, I had to crutch myself down this extremely long hallway to even get to the office, and I was like just struggling. I was in so much pain. And I was out of breath, and so I get into her office, and she says, they didn't check your chest for blood clots. And I said, no, they told me since I was pregnant that it wasn't safe to do that and that they weren't worried about the blood clots traveling. And she said, I just can't let this go. Like, we have to make sure because you are out of breath just getting to my office. And I said, okay, whatever we need to do. She said, you need to make sure that your baby is getting enough oxygen. And that was like the first time I was like, oh, you're right, I'm pregnant. Like, I was in so much pain and had so many medical issues that I like couldn't even go there. And I remember saying to her, well, I need oxygen too, and I need to get enough oxygen and be here for my kid and my husband. Like, I couldn't even, and yeah, I was only 10 weeks pregnant, but still I couldn't even, it wasn't even a priority in my head, which is so crazy to think about now. But it's because looking back, I was in so much pain, and I was literally dying and didn't even know it. So she sent me to, she said, I'm going to call the ER. And she sent me to Beaumont Royal Oak, and I got there, and it took a while to get back, but they finally determined that I had multiple bilateral pulmonary embolisms. So that means I can't even remember how many he told me I had, but I had a lot of little blood clots in both of my lungs. So mind you, this was the next morning after I had been discharged from Genesis, when they said they weren't worried about them traveling to my lungs. So they obviously were already there. And I can remember even before I went into Genesis trying to read a book to Grace at night, and I was out of breath. And I remember asking Donnie to read the book because I couldn't read a book to her. I was out of breath reading the book to her. Looking back, like, if I would have just been aware of the increased risk of blood clots in pregnancy, I would have maybe recognized those symptoms. But I didn't even know that was a thing, especially considering I didn't have that issue with my first pregnancy. But I'm here to tell you what the conventional medical professionals tell me anyways, is that pregnancy within itself puts you at risk for blood clots because of the increased estrogen. So you're most at risk in your first trimester and directly after you have baby, when your estrogen levels are changing. So, long story short, I was in the hospital at Beaumont for a good couple days, maybe almost a week. And, Wendy was the person that really, she was the provider that didn't see me in person, but knew more what was going on than anybody else I saw in person in those time periods. Chiropractic and massage was probably the worst things that I could have done, but it happened the way it was supposed to happen. But yeah, I just want to say that because home birth midwives are often viewed as professionals that have less tools or skills, and I really feel like they have tools and skills that OBs or hospital midwives don't have, because they have to be more in tune with women and women's bodies and the babies in those bodies, and not rely on things like ultrasounds and numbers and dilation and they are more in tune with that person than with the numbers that are related to that person, if that makes sense. So she heard what I was saying and knew what to be concerned about, and she's the only one that pegged it. I remember she was just so shocked too, like, oh my gosh, I can't believe this is really happening, because it's rare. But needless to say, we couldn't hire her, and she was the most helpful person out of my whole pregnancy, essentially. But yeah, so we went home, and I remember it took me a little while to get to the point where I could even walk around. At this point, I was pretty proficient at using a needle to inject blood thinners into my body, into my abdomen. So I was injecting Lovenox into my abdomen twice a day, which in the beginning of a pregnancy doesn't seem as wild as it does in the end, when especially for me, I have such a hard time gaining weight in pregnancy because I'm always so ill, and I don't get very big, and I just didn't have a lot of fat to push the needle into, which is what you're supposed to do. So it was just such a weird experience to be pregnant. And what, your hands? Are your hands asleep? Yeah. But yeah, it's such a weird experience to be. pregnant and injecting blood thinners into my abdomen. All done? Oh, you're sweaty. So, I ended up getting taken off work for the rest of my pregnancy, and found myself in a stay-at-home mom position with one kid, and luckily Grace slept really well with me, so because I needed so much sleep. I just slept. I remember we'd get up at like 11 o'clock every day, and I ended up, sorry, I was trying to get your hair out of the way. I ended up night weaning her because I just needed the sleep, and it was super easy to night wean her. Remember it took like one night, and it just was like no big deal. But yeah, the biggest things were, processing that trauma of almost dying, because I mean I was literally told like another 24 hours and it would have been a really dicey situation. The OB did a great job identifying that I needed to go back to the hospital, but she struggled to listen to me, and basically told me what was going to happen with my body and my birth, and at one point told me that she was going to induce me at 36 weeks, which after I had already told her that I wasn't interested in that, she was really stuck on, what should happen in that scenario where you are taking blood thinners. They really recommend stopping the blood thinners and then inducing and then getting right back on them to really control the situation. And there was just multiple situations I didn't feel comfortable with. So, and at one point she, even told me that she was very nervous about my birth, and talked about, staying in a hotel to be closer because I was, an hour from the hospital, and, just a lot of fear. Everything was just really fear-based with her. She said that I was her first client with this type of situation, so I ended up, my doula, Diana, helped me get switched over to Henry Ford West Bloomfield, and the midwives were allowed to be on my case as long as I saw the OBs as well. So I ended up switching over to them at 35 weeks, and got a little time to get to know them, but it was really, it was nice to be with midwives, but it wasn't like home birth midwife. It's still, there was a lot of talk about being compliant with things so that I could keep the midwives and things like that. But long story short, there was no need to induce because my water broke at 36 and 6 days. So that's where I will leave this, with a cliffhanger, right? But yeah, let me know if you have any questions or if this resonates. I'd love to hear from you. Hope you're having a great day.